What is childhood trauma? Childhood trauma, also known as adverse childhood experiences, ACEs, refers to the emotional, physical, or psychological harm that a child experiences during their formative years. This trauma can be caused by various factors, including abuse, neglect, domestic violence, parental substance abuse, or other stressful events. Main reasons for childhood trauma. 1. Physical abuse. Physical harm or injury inflicted by a caregiver or other adult. 2. Emotional abuse. Verbal or psychological harm, such as belittling, humiliation, or rejection. 3. Neglect. Failure to provide basic needs, such as food, shelter, or emotional support. 4. Domestic violence. Witnessing or experiencing violence between caregivers or other adults. 5. Parental substance abuse. Growing up with a caregiver who struggles with addiction. 6. Bullying. Repeated physical or emotional harm inflicted by peers. 7. Loss or separation. Experiencing the loss of a loved one or separation from a primary caregiver. Effects of childhood trauma. 1. Anxiety and depression. Increased risk of developing mental health disorders. 2. Difficulty with emotional regulation. Struggling to manage emotions, leading to mood swings or explosive behavior. 3. Trust issues. Difficulty forming and maintaining healthy relationships. 4. Low self-esteem. Negative self-image and self-worth. 5. Hypervigilance. Increased sensitivity to stressors and a heightened sense of alertness. Overcoming childhood trauma. 1. Seek professional help. Consult with a therapist, counselor, or psychologist specializing in trauma. 2. Support groups. Join a support group to connect with others who have experienced similar trauma. 3. Mindfulness and self-care. Practice mindfulness, meditation, and self-care activities to manage stress and emotions. 4. Reframe negative thoughts. Challenge and reframe negative self-talk and thoughts. 5. Build a support network. Surround yourself with positive, supportive relationships. Time it takes to overcome childhood trauma. The time it takes to overcome childhood trauma varies greatly depending on 1. Severity of trauma. More severe trauma may require longer treatment. 2. Individual resilience. Personal coping mechanisms and resilience can impact recovery time. 3. Quality of support. Access to effective therapy, support groups, and positive relationships can accelerate recovery. 4. Consistency of effort. Regular engagement in therapeutic activities and self-care can lead to faster progress. Recovery from childhood trauma can take short-term, several months to a year for mild trauma with effective treatment. Medium-term, 1-3 years for moderate trauma with consistent therapy and support. Long-term, 3-5 years or more for severe trauma, requiring intensive therapy and support. Keep in mind that recovery is a unique and individualized process. Be patient, kind, and compassionate with yourself as you navigate your healing journey.